Let's talk about fifth metatarsal fractures, or Jones fractures. I'm Dr. David Geyer, orthopedic surgeon, sports medicine expert, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. The metatarsals are the long bones in the foot, below the toes. And there's 5 of them below each of the 5 toes. These are those long bones. And the 5th one is the outer of the metatarsals on the outside of your foot. And it's really difficult if you suffer a fracture of the 5th metatarsal. Now there's sort of 2 categories of 5th metatarsal fractures. If you're older, maybe in your 50s, and you turn your ankle, like what you think is an ankle sprain, you can actually break the bone at sort of the base of that 5th metatarsal. It's uncomfortable for sure and takes time to heal, but that almost never needs surgery. That may be a boot for 4 or 6 or 8 weeks, but rarely does that need surgery. Just needs time to heal. The key is diagnosis. You think it's an ankle sprain, but instead of the pain being at the ligaments up higher, it's at the base of that bone on the outside of the foot. I've done another video about how you can suspect that you may have a fracture, and I talked about you have really specific pinpoint tenderness at a particular part of the bone. Well, in this case, it's going to be right at the base of that 5th metatarsal. But there's another category or subcategory of these 5th metatarsal fractures that have been called Jones fractures. These are typically in your athletes, high school, college, pro athletes, or men and women in their 20s that are really active, may have a specific traumatic event, can actually come from a stress fracture that's occurred over time. But instead of being at the base down here, it's a little further up the shaft of the bone, sort of about a third of the way up. The reason that matters, there's 2 reasons. One, the blood supply in that region is not terrific, and the forces on that bone in that location sort of pull it apart. So that area is prone to not healing very well. So in our active population, and certainly our high-level athletes with a Jones fracture, sort of the junction between what we call the metaphysis, the flare of the bone, and the shaft, the long tubular part where I was showing you, if an athlete has a fracture there, a lot of times, most of the time, we're probably going to talk about surgery, where we put a screw down the center of the bone to compress it and get it to heal. Okay, I would love to know the number 1 challenge that you face with your injury. If it's a 5th metatarsal fracture or Jones fracture or any other type of injury. In the description below this video, the very top link will take you to a page on my website, and you can share all the information about your injury and the challenges that you face with that injury. That information is so valuable because it helps me understand what you're going through, and that helps me better design articles and videos and webinars and ebooks and other courses that can help me give you information that helps you understand and overcome your injury. If you like videos like this, subscribe to my YouTube channel. I record several of these videos each week on sports and exercise injuries and injury prevention, injury treatments, and I do live Ask Dr. Geyer videos, and you'll get notified about all of that only if you subscribe. So click the subscribe button in the upper right corner of the page. Thank you so much for watching, and I look forward to seeing you right here in our next Injuries and Surgeries video.